This program aims to find solutions to your medical queries. It seeks answers to common health problems that have been hounding you. We will help you out in finding answers to your medical concerns. I'm Angel Jacob and this is MedTalk, your weekly on-air health consultation here on the Solar News Channel.
For Efrain Tumaning, a retired policeman, dialysis treatment is nothing new. If many are intimidated by this machine, Efrain has gotten used to it. He undergoes hemodialysis twice a week due to severe kidney failure.
Tumas yung creatinine. At sinabi namin na may kidney trouble ako.
The kidneys are two bean-shaped organs, each about the size of a fist.
The kidneys are generally functions to filter the blood, yung lahat ng mga solutes and all of the compounds that we take and all of the metabolites of our system generally is being excreted through the kidneys.
Efrain's kidneys have had cases of recurring kidney stones that eventually led to kidney malfunction.
Nagkakaroon ng stasis ng urine within our bladder. So what happens is that dun sa stasis ng urine sa bladder natin, nagkakaroon ngayon ng environment na very prone to develop stones.
Despite high costs, Efrain makes sure that he never misses his dialysis session.
We hook the patients on a certain machine wherein the blood is going to be cleansed or filtered through the dialysis machine.
He is positive that his condition will get better.
Gusto ko pang mabuhay, ma'am, ng mababa ng konti kung pwede.
What are the medical breakthroughs in treating kidney problems? What are the symptoms of kidney failure? How can we prevent having kidney ailments? Find out the answers tonight on MedTalk.
And joining us tonight is Dr. Dolores Bonzon, pediatric nephrologist from the Manila Doctors Hospital and chief of the Pediatric Nephrology section of the Philippine General Hospital. Also with us is Dr. Elizabeth Montemayor, head of the section of nephrology at the hemodialysis unit at the Manila Doctors Hospital. Also joining us tonight is Dr. Ronald Perez, adult nephrologist from the National Kidney and Transplant Institute. Good evening, doctors. Welcome to the show.
Good evening.
Tonight, it's all about kidney care.
Yes.
And, you know, the kidney is would you say, one of the most neglected parts of our body because it's behind. So when we look at ourselves in the mirror, we often forget that it's there until it cries out for help.
Yes. Exactly, yeah.
So first, let's locate our kidneys. I mentioned they're behind. So where exactly are our kidneys located?
It's located at the retroperitoneum. It basically means that it's at our backs. So it's located there, and we don't normally see it because we always look at ourselves in front of the mirror, but we don't really look at ourselves at the back. So that's the reason why it's often neglected or taken for granted.
And why are, yes, doctor?
Yeah, the thing is that we don't even know that our kidneys are there until we feel some pains or we're having difficulty in urination. The kidneys are our silent worker. It's there working for us every second of the day to do the things that make us normal. If you eat salt, the kidney will remove all those salt because we are already perfect. So the kidneys try to balance everything in our system. So if you drink a lot of water, the kidneys will remove this excess water. If you take in salt, the kidneys will remove this. Substances like preservatives will be removed by the kidneys.
And that's why it's important to take note of its function and how to keep it healthy,
Yes.
and how to make it work the way it should.
Yes.
Correct.
Doctor, so what exactly is its function aside from those that you've mentioned already? Dr. Bonzon?
We always look at the kidneys like a filter, no? After all, the main part of the kidney, which we call the glomerulus, its function is to filter our blood, to cleanse our blood of waste products and excrete them, and also to conserve those substances that are important to the body. So, in that sense, pwede nating tawagin ang kidney na parang glorified garbage disposal system, no? Why? Because it not only excretes waste, but it's very intelligent. It keeps the substances that are important to our body and balances important electrolytes like what Dr. Montemayor said, the sodium, potassium. It also reabsorbs substance like glucose, no? Although hindi naman siya yung nagre-regulate talaga, no? So, it does a lot of things. It even regulate our blood pressure, no?
The kidneys are also endocrine organs, no? Like the kidneys produce at least three kinds of hormones. One is the active form of vitamin D, which is very important in calcium metabolism. The second is, we call this erythropoietin. It is necessary in the production of the red cells. And the third is renin, which is important in the control of blood pressure. Yeah. So the kidneys really reign supreme in the control of blood pressure.
And so we always must be aware and alert of what's going on in our body. What we put in, our kidneys must excrete, must put out. And how do we describe a healthy kidney? What are the characteristics maybe of a healthy kidney?
Well, the characteristic of a healthy kidney would be one, it's able to excrete the adequate amount of urine. So, depending on your fluid intake, an average of 1 liter will be okay. So that's one. Secondly, you don't have any pain, or when you excrete urine, it has to be yellow, light yellow in color. Because if it's dark, it means that you're not taking in too much fluid. So that's also bad because if you have a concentrated urine, you will have crystallization that can bring about the creation of kidney stones. And it does not have blood. It should not have blood. And when you urinate, you should not have any pain. Because when you have pain, it means that you have an infection or you have a kidney stone that is being passed out in your urinary tract.
So we mentioned, you've already mentioned a little bit of the signs and symptoms of one who does not have a healthy kidney.
Yes.
Can we go into that a little bit more about the signs and symptoms of an unhealthy kidney? Because we already talked about a healthy kidney.
Most of the time, there are really no symptoms, and that's the reason why most patients will present to you in the end-stage kidney disease. No, they don't even notice that they have any kidney problem.
Why is that, doctor?
Because the kidneys are very silent workers, and even if the kidneys are failing, the kidneys try to still maintain its function. So if, let's say, in the 1 million kidney cell population of one kidney, if half of that is non-functional, then the remaining kidney cells will take over the function. So they try to work harder. They work harder.
They work double time.
Yeah, they work
compensate
to compensate.
for that.
And so eventually half of them will fail again, and that leaves you with 1/4 cells functioning, taking over the function of the other 3/4. And that's the reason why kidney failure is progressive, because the kidneys take over the function of the other cells, and they really deteriorate fast, and they would deteriorate faster.
They deteriorate fast because of, again, it working double time to
Yeah,
compensate
harder.
for the
Yeah.
loss already of
Yes,
the other
yes.
cells that it
But
must
usually
be
when
doing.
they have late stages already of failure, patients would have hypertension. It can be as subtle as hypertension, or they may have bubbly urine. Now, I would tell my
Bubbly
patient
urine.
bubbly urine. So think of it as you are pouring beer into a glass.
Can
So that
imagine.
is the bubbly urine consistency. And sometimes they see that their volume of urine has gone down considerably, less than a liter per day, without doing anything. So these are sometimes late stages already in kidney failure.
How about in children, Dr. Bonzo?
Ang difficulty sa mga bata, unlike adults, we deal with different age groups, no? Meron tayong bagong panganak, mga neonates, newborn neonates, meron tayong toddler stage, meron tayong school age, may adolescent, no? So, ang dami. So, sometimes iba-iba yung mga presentation ng kidney problems. But very common would be yung pamamanas, no? Kadalasan yung konting we call it periorbital edema na namamaga paggising yung talukap ng mata. It might be a sign of a kidney problem,
At
no?
what age, doctor, is that noticeable?
Any age.
age.
Any
Oo,
age.
actually, less than 2 years old, pwede. And then the severity is different depending on the age of presentation, no? Ang isa pa, pwede ring magbago yung kulay ng ihi, like maging kulay red or tea-colored or Coca-Cola colored. It denotes na may dugo sa ihi. And normally, we should not have a lot of halos walang red blood cells dapat sa urine kasi hindi siya dapat makalabas dun sa filter, no? Yung sinasabi ni Dr. Perez na bubbly urine, it denotes na maraming protein sa urine natin. And proteinuria, no, yung term doon, is a much more serious sign of a kidney problem kasi it really tells us sira yung filter ng kidney natin. So yun, manas, pagbago ng kulay ng urine natin, red or tea-colored, or magkaroon ng protein, and even yung sa latest stage, yung pamumutla, no? Because of the lack of erythropoietin that is necessary para mag-produce yung bone marrow natin ng red blood cells.
And when our kidney fails to function the way it should, there's this thing called renal
Failure.
renal failure
failure.
and chronic kidney disease. So let's
Yes.
talk about renal failure first.
There are two
Manimura.
kinds of renal failure. One we call the acute kidney injury. This one can be reversed. So, like now we have floodings, and the cases of leptospirosis we will see a lot of cases of leptospirosis, and the leptospirosis will affect the kidneys. These are reversible kidney failure, but if if you have diabetes, hypertension, or if you're a smoker, these things will slowly destroy the kidneys, and you will have chronic kidney failure. But this is irreversible.
Okay, so acute renal failure is treatable,
Yeah,
can be
reversible.
cured,
Yes, reversible.
And if not treated well, when is it diagnosed as chronic kidney failure? How long after, or are there any other signs?
Usually
and
depends on
symptoms
the
to watch out for?
history. Depends on the history. For example, you wade in the flood and you come here without any urine, so we would think of leptospirosis. Or, for example, you got dehydrated, you had diarrhea, and you come to the hospital without any urine, then that means that maybe you have acute kidney injury. But if you have diabetes, if you have hypertension, then and you come and come to the hospital with very high levels of creatinine, then we can say that maybe that is a chronic kidney injury. Yes. So
Okay.
the history is very helpful.
And you also must be aware of you know, your activities, your food intake. You're taking a lot of water. From I gathered from our discussion, is really very important to flush out all the toxins.
Yeah.
To
More
flush
than
out all the
more than the food intake, Angel, it's we have to know also what are the patients taking, especially medicines. There are certain like we get we get herb what we call herb nephropathy, wherein they take indiscriminate amounts of herbal medicines. They don't even know.
They self-medicate.
They self-medicate. They don't even know what it's used for. But they say that because of testimonials from their friends, neighbors, they take
they
them.
try it as
they
well.
try it. There's some like diuretics or that's yung tatawag natin pampaihi, can also cause derangement in our sodium content.
Okay.
So,
Doctors, I don't mean to cut, but we have to go to a gap. More on kidney health when MedTalk returns.
Did you know that the first kidney transplant between living patients happened in 1954 in Boston? The procedure was done between identical twins, Ronald and Richard Herrick. Dr. Joseph Murray, who eventually received the Nobel Prize for Medicine in 1990, performed the operation.
We are back here on MedTalk, still talking about kidney health. Doctors, before our break or our gap, we were talking about those who self-medicate.
Yes.
And they think that that's good for them. But syempre, it depends, no? From individual to individual. But we will go back to that discussion. First, we have to answer a question from Twitter. Doctors, I have urinary tract infection or UTI. Can it lead to serious kidney problems? Yes, Dr. Bonzon.
Alam mo, ang UTI sa pediatric population, it's a very big issue, no? Because unlike in adults, there are many connotations, lalo na kung yung UTI sa bata, paulit-ulit, which we call recurrent UTI. And it's a big debate in the whole pediatric nephrology world. Ano bang gagawin dito sa mga batang to? Not so much yung paggamot dun sa infection, but mainly on what tests need to be done to make sure that the frequent urinary tract infection is not causing damage to the kidneys. Because there are some children who are on dialysis because of neglected recurrent urinary tract infections, not knowing na there's some anatomic problem in the urinary tract of the child, no? So, ngayon, we have a lot of clinical practice guidelines na meron sa America, meron sa Europe. So, and what to do pagka madalas mag-UTI ang mga bata. One is an ultrasound of the kidney, ureter and bladder, and then recommended then based on current guidelines yung scan ng kidney, and another one which we call the Boyding cystourethrogram. But these tests are not done right away, unlike many years ago. Because with experiences, we now have certain parameters to consider kung ano yung unahin, ano yung paggagawa. But siguro para sagot dun sa tanong, in children, yes, it can damage the kidney and it can damage the kidney really badly.
In adults, briefly, doctors?
Yeah, in adults, we have different kinds of urinary tract infection then. The most common is we call this the uncomplicated urinary tract infection. And this happens only, we call that uncomplicated, if it's urinary tract infection among females.
Is it more common among females?
Yeah,
Yes.
yeah, than males. Because of the basic nature of the anatomy, usually the infection comes from the stool, from the gastrointestinal tract, the bacteria then colonizes the vagina, and then goes up to the urethra. No? So among males, because of the
Anatomy
again,
yes.
so they're less prone, and therefore urinary tract infection among males is considered complicated. So there's only one kind of uncomplicated urinary tract infection, usually that's a married female, happens only once in a while, and there is this usually a burning sensation, which we call dysuria. Many urinary tract infections are asymptomatic. And that is the more complicated urinary tract infection.
Which should be addressed right away and identified.
Identified, yes.
Another question, doctors, from our Facebook page. Can a person function with a single kidney? Just one kidney?
The answer is yes, you can. Only as we can all survive with one kidney. So that's the reason why a person, a healthy individual, can donate an organ and then still survive without dialysis.
How is it with just one kidney? I mean, two is better than one.
Yeah,
Yeah,
How
definitely
is
two
it?
is better
Yeah.
than one.
How is it with just one kidney?
Yeah, but one kidney, if it's a working kidney, it's a normal kidney, it's a healthy kidney, there should be no difference. There shouldn't be any difference in the lifespan of that individual.
Maybe that's why there are two, because
You can afford to give
give one
one.
to those
But
who
the
need it.
remaining kidney undergoes what we call compensatory hypertrophy kasi yung dating function niyang isa, dalawa na ngayon.
to work double time.
Oo.
Overtime. Kasi nga silent worker siya, so talagang
Saka may mga taong pinapanganak na iisa
Isa
lang
lang.
ang kidney. We call that solitary kidney. So, okay lang talagang mag-donate. Gift of life.
so yung mga pinapanganak with just one kidney, not
Hindi sila-
necessarily
oo.
na they can have one more or they can
Hindi
give one.
kailangan.
No
Oo.
need for that. Okay. Another question, doctors, from Twitter. I was told that kidney infection is more common among pregnant women. Is this true?
That's not really true. The prevalence of infection among married women is similar to the non-pregnant. Yeah, pregnant women and non-pregnant women, they have the same prevalence, but it's more serious when it happens among pregnant women because it can lead to, there are many complications here. Because of the changes in the urinary system associated with pregnancy, the usual uncomplicated urinary tract infection becomes complicated. It goes up to the kidneys and become a systemic infection. It can also lead to prematurity of the baby. So, so we treat the infection in the pregnant women more seriously.
And the pregnant woman keeps going to the bathroom because the baby is pressing on the bladder.
Yes.
So,
Yes.
frequent
Yeah,
urination.
they have smaller bladder capacity.
That's right, doctor.
Yeah.
So we'll go back to our Facebook and Twitter questions in a little while. But now let's talk about the treatments available. We've talked about the signs and symptoms. We've answered our Facebook questions. Now let's talk about the treatments that are available to those who have been diagnosed with kidney failure. So what are the treatments, Dr. Perez, available here in the country?
If you have an acute kidney injury, the extreme case would be the patient would undergo hemodialysis.
What is hemodialysis?
Hemodialysis is basically a treatment, a device wherein we have a filter and then we insert a vascular access, usually at the neck area, and the blood is taken out from your body. It goes to the machine, it goes to the filter, and goes back to you. Now, the filter or the dialyzer basically removes all the toxins of your body. At the same time, it removes the excess water in the body. Now, but if, for example, a hospital does not have a facility, hemodialysis facility, a peritoneal dialysis would suffice. Now, the peritoneal dialysis is different in the sense that we use our peritoneum or omentum rather as our dialyzer. It's the supotanchan. And then we put special fluid inside our stomach, and then we let that special fluid stay in our stomach for a couple of hours. Then it's removed out, because that special fluid will be the ones to absorb the toxins, at the same time remove the excess water in our bodies. So that's for acute. Actually, those two modalities that I've mentioned, we also use it in chronic kidney disease. But the ultimate treatment for chronic kidney disease, those who are in failure and both kidneys are already damaged, would be kidney transplant.
Right away. So they are candidates for a kidney transplant if the dialysis, the hemodialysis, does not work for them.
Actually, chronic kidney disease, in chronic kidney disease patients, both the hemodialysis and peritoneal dialysis are just temporary measures. It's like tiding them over to the next day. But strictly speaking, if you want them to have a new normal life, then a kidney transplant would be best for them.
Yeah, we consider the kidney transplant as the best option for renal replacement therapy because that usually puts them in the mainstream of life again.
And then they're back in the pink of health, and it's working as it should.
Should be.
And we're talking about working as it should be. Our kidneys, June is National Kidney Month, and there are certain activities to help us become more aware and to help us take good care of our kidneys. So doctors, please tell us about
Well, for one, we're here right now promoting kidney health. In National Kidney and Transplant Institute, we have every Friday, it started the first week of June, we had what we call kidney screening. So the patients can avail of free services such as urinalysis, fasting blood sugar, serum creatinine levels. And then aside from these free laboratory tests, they have free consults from our doctors in National Kidney Institute. We also had what we call celebrating our donors. We want to give preference to the donors who sacrifice their life so that their loved ones or the recipients, their loved ones who are recipients, will have a new normal life. And then we had vaccinations for...
So what was the vaccination?
Vaccinations for our chronic kidney disease patients who are kids. So we had vaccinations through the help of our pharmaceutical company sponsors. And that also was one of the activities of National Kidney and Transplant Institute.
Just like last Sunday, the section of nephrology, both adult and pedia of the Philippine General Hospital went to Alitagtag to conduct medical missions. So, Alitagtag in Batangas.
And the focus was kidney health.
Kidney health. Kidney health.
All of us are members of the Philippine Society of Nephrology, and our society every year celebrates Kidney Month. And all of our chapters nationwide would have activities related to Kidney Month also. And there's another month that we highlight kidney health and kidney diseases. That's during World Kidney Day.
So when is World Kidney
That's in March. Second Thursday, I think, of March.
Thursday of March.
Okay, so that's different from
That's
this
National Kidney Month.
World,
This is
worldwide.
So just in time to give our viewers more information on how to take good care of their kidneys.
We're just wrapping up our activities for Kidney Month
long.
Yeah.
And in speaking of wrapping up, we have to wrap up our discussion on how to take good care of our kidneys and understanding the silent worker in our body. So again, I'd like to thank our doctors, Dolores Bonzon, Dr. Elizabeth Montemayor, and Dr. Ronald Perez for joining us in our discussion tonight. See you again next Tuesday on MedTalk as we talk about nutrition. 10 p.m. on your scheduled on-air consultation on Solar News Channel. This is Angel Jacob. Good night.
Kidney stones that eventually led to kidney malfunction.
Nagkakaroon ng stasis ng urine within our bladder. So what happens is that, dun sa stasis ng urine sa bladder natin, nagkakaroon ngayon ng environment na very prone to develop stones.
Despite high costs, Ephraim makes sure that he never misses his dialysis session.
We hook the patients on a certain machine wherein the blood is going to be cleansed or filtered through the dialysis machine.
He is positive that his condition will get better.
Gusto ko pang mabuhay, ma'am, ng mahaba ng konti kung pwede.
What are the medical breakthroughs in treating kidney problems? What are the symptoms of kidney failure? How can we prevent having kidney ailments? Find out the answers tonight on MedTalk.
And joining us tonight is Dr. Dolores Bonzon, pediatric nephrologist from the Manila Doctors Hospital and chief of the pediatric nephrology section of the Philippine General Hospital. Also with us is Dr. Elizabeth Montemayor, head of the section of nephrology at the hemodialysis unit at the Manila Doctors Hospital. Also joining us tonight is Dr. Ronald Perez, adult nephrologist from the National Kidney and Transplant Institute. Good evening, doctors. Welcome to the show.
Good evening.
Tonight, it's all about kidney care.
Yes.
And, you know, the kidney is would you say, one of the most neglected parts of our body because it's behind. So when we look at ourselves in the mirror, we often forget that it's there until it cries out for help.
Yes.
Exactly, yeah.
So first, let's locate our kidneys. I mentioned they're behind. So where exactly are our kidneys located?
It's located at the retroperitoneum. It basically means that it's at our backs. So it's located there, and we don't normally see it because we always look at ourselves in front of the mirror, but we don't really look at ourselves at the back. So that's the reason why it's often neglected or taken for granted.
And why are, yes, doctor?
Yeah, the thing is that we don't even know that our kidneys are there until we feel some pains or we're having difficulty in urination. The kidneys are our silent worker. It's there working for us every second of the day to do the things that make us normal.
This program aims to find solutions to your medical queries. It seeks answers to common health problems that have been hounding you. We will help you out in finding answers to your medical concerns. I'm Angel Jacob, and this is MedTalk, your weekly on-air health consultation here on the Solar News Channel.
Efrain Tumaning, a retired policeman, dialysis treatment is nothing new. If many are intimidated by this machine, Efrain has gotten used to it. He undergoes hemodialysis twice a week due to severe kidney failure.
Tumas yung creatinine. At sinabi namin na may kidney trouble ako.
The kidneys are two bean-shaped organs, each about the size of a fist.
The kidneys are generally functions to filter the blood. Yung lahat ng mga solutes and all of the compounds that we take and all of the metabolites of our system generally is being excreted through the kidneys.
Efrain's kidneys have had cases of recurring